and welcome. My name is Joe Furia, and I'm Executive Director of World Forestry Center, a nonprofit working at the intersection of people and forests for over 50 years. At World Forestry Center, we believe that how we manage forests impacts everyone, and that forest issues are fundamentally social issues. For the second part of our two-part series on the public health impacts of wildfire smoke, we've brought together a group of public health experts who are working to communicate the risks of wildfire smoke to the public. Together, they'll discuss how we can raise awareness of this critical issue and advance measures that can mitigate those risks. This program will be moderated by World Forest Center's Director of Experience, Tim Hickox. Hello, Tim.
Hi, Joe. Thanks so much for that warm welcome, and really excited to be back to moderate the second program on the public health impacts of wildfire smoke.
Sounds great. Well, I'm going to turn it over to you, let you introduce the panelists, and get the discussion underway.
So as a reminder, for part one of the program, we brought together leading researchers to have an engaging conversation on what we know about the health impacts of wildfire smoke, who is most at risk, and what future research is needed to understand the full cost of this issue. Today, we're joined by 5 additional panelists who represent a really broad range of people working at the intersection of wildfires and public health. Our discussion will build on what we heard in part one and focus on successful strategies for building community resilience to wildfire smoke and what we can do more to protect vulnerable communities. So I'm going to provide just a brief introduction of each of our panelists and encourage viewers to check out their full bios as well as the recording of our first program at worldforestrycenter.org. So with that, I'll introduce our panelist. Susan Stone is with us today, a senior environmental health scientist at the EPA's Office of Air Quality Planning and Standards. Sarah Coefield, air quality specialist for Missoula Public Health. Gabriela Goldfarb, environmental public health section manager at Oregon Health Authority. Ira Cuello Martinez is a policy and advocacy director at PCUN, Oregon's farmworker union. And Savannah Devlin, postdoctoral fellow in the Department of Environmental and Occupational Health Sciences at University of Washington. Thank you again for being here, everyone. Before we get started, I just want to acknowledge that although fire is an integral part of healthy forest, large and severe wildfires are an unnatural and complex issue that we see as one of the most pressing challenges facing society today. We at World Forestry Center envision a future which everyone connects forest health to their own well-being, and is why we have decided to have these conversations with leading experts in the field to identify both the impacts and the actions that we can take to overcome these issues. So thanks again for being here. With that, I'd like to kick it off with our first discussion question. And really, it's just to get people's first take and reactions to part one of our program. And Savannah offered to give us a short recap. So Savannah, I'll hand it off to you, and maybe you could also share what you're excited about discussing today.
Yeah, absolutely. I thought that part one was fantastic. I really enjoyed watching it, so I hope everyone else does as well. Just kind of what you started with, Tim, was how they started the discussion as well, talking about how severe wildfires are not normal. And there were some great statistics that they brought up at the beginning, talking about how even a decade ago, wildfire smoke contributed to about 10% of air pollution, and now it's about 50% of particulate pollution, which is obviously a huge spike. And they talked about how with this spike in wildfire prevalence and smoke prevalence, we also have seen this kind of wonderful and exciting spike in research as well. More and more people are doing research on wildfires and wildfire smoke that have already been helpful. We have a long way to go, and they acknowledge that, but we're already learning quite a bit about what the health impacts of smoke exposure are. They talked through a lot of great research. Some of the ones that stood out to me was compared to other pollutants. So we think about urban pollutants or traffic-related air pollution. Wildfire smoke has been shown to cause more hospitalizations and ER visits compared to other types of pollutants. It's also been shown to be much more toxic in laboratory studies when compared to other pollutants. But something that is really cool about the health research of wildfire smoke is that we know a ton about how air pollution impacts our health. And so there's a lot that we can learn from what we know about air pollution into how wildfire smoke impacts health. Some of those things that were mentioned is obviously respiratory disease is exacerbated. Things like asthma and COPD are exacerbated with exposure to wildfire smoke, cardiovascular disease. And then they brought up some other health effects, such as the acute health effects of wildfire smoke. That's things like ear, nose, and throat irritation, and also headaches, trouble sleeping, things that maybe seem small, but if you're being exposed to wildfire smoke season after season for longer and longer periods, those things add up and really change the summer experience, and now into the fall as well. And I loved how in part one they talked about health effects, but they also kind of went into, okay, what are the things that we can do next? And I'm hoping that we talk a lot more about that today. I'm looking forward to it. One thing that they talked about was how there's been kind of this difficult, not comparison, but difficult combining of COVID plus wildfire smoke in the last several years, and how really things that we're recommending, such as during COVID, stay outside, we're going to have classes outside, or we're going to have meetings outside. Obviously, when a wildfire comes through town, that is not helpful. And so there's this balance that has happened between COVID and wildfire smoke exposures that have been really challenging. And that has also been seen in messaging around what we do during a wildfire smoke event, as far as masking or steps we take as far as keeping kids inside or not. And so again, it's a balance, and I'm sure that is going to come up quite a bit today. And towards the end of the conversation, I think it was Anna Rappold talked about how there's all these things that we can do, but she's not sure that society is really ready to take these steps. She asked a question of, okay, are we really ready to change our lifestyles to this smoke that is, we know it's not going away anytime soon. Smoke exposure is inevitable for communities on the West Coast and the Mountain West, and as we've seen in recent seasons, over to the East Coast as well. Smoke's moving across the U.S. and across the world as well. And so I'm hoping today, and I'm excited to have a discussion with the other panelists about what can we do so that individuals really are ready to make these changes, and what kinds of steps can we take as community advocates for smoke readiness and researchers ourselves for making this an easier transition as we hopefully over time minimize the severity of wildfires, but that's going to be a while still. So what can we do to live more safely with smoke?
Thank you so much. And I think I'm glad you reminded me, because as I also meant to say that, a lot of our conversation and kind of big takeaway for doing these programs is the overarching message that we as people, as humans, need to find a better balance in how we live with fire on the landscape, because we know we need it, and it's not going away anytime soon. So with that, I think I'll hand it over to Sarah and get your takeaways, Sarah, on behalf of the state of Montana, and knowing that that's one of the states in the West that's experiencing some of the worst air quality with these severe fires. So was there anything that stood out to you or really resonated with you and what's happening in your community?
Yeah, thank you, Tim. And we have certainly seen in Western Montana those really prolonged smoke events where you can have smoke lasting for days and weeks and even months at a time. That is unfortunately becoming, I want to say it's a new normal, but it's a recurring phenomenon for a lot of mountain communities across the West, as we have these fires that start in sometimes early July and burn until it snows, which can be sometime in October. So as we are faced with these longer and longer smoke events, it really is becoming an issue of, well, how to make decisions about how to stay healthy when the smoke is going to stick around for this long, and how do you make those discussions with yourself of like, okay, well, I need to exercise, but the smoke's still going to be here when that happens. Do I have access to cleaner indoor air? If I don't, what can I do to maintain my physical body while not exposing myself to these pollutants more than necessary? Is that a respirator? Is that finding a cleaner indoor airspace? Is that timing your workout for like when there's a break in the smoke? It's all these things you have to really kind of take into play as you go through this. Another thing that really stuck out to me is the role of indoor air quality monitoring on behavior and in our understanding of how wildfire smoke impacts our indoor environments. Because as a lot of us know, up until a few years ago, it was really common for the best advice be just go inside. And now we have a much better understanding of how much smoke is coming indoors. So there's the question raised of are people responding to that information and taking steps to clean their indoor air? And there seemed to be a little bit of disagreement about that amongst the panelists. There's also the question, like something that I think that we need to acknowledge is there's a barrier to even having that information. You know, a low-cost purple air sensor people are using in their homes costs $200 roughly, maybe more now. I don't know the exact amount. That is a barrier for a lot of people who would not have any way of measuring, even getting information about their indoor air quality. So even in those studies looking at indoor air quality during wildfire smoke events, that is a really self-selected sample of people who have the means and the time and the energy to get themselves their own air monitor, plug it in, set it up, watch it, and respond to it, and then even have access to the tools that they need to clean their indoor air in response to those data. So I think that we need more indoor air quality monitoring. I'm a huge fan of knowing what the indoor environment is. We also need to acknowledge the barriers to even having the information. So what can we do in the absence of those data? So how to get people to respond to the data when they have it, and then how to get the data to more people, I think are important questions.
Great, thank you, Sarah. I think that's also a good segue to Ira. Ira, I know you're here somebody today that works with a very specific community instead of the public at large. Was there anything that really stood out to you that resonated with the issues affecting the farm worker community?
Yeah, definitely. After watching the first program, some things that really resonated with me that I've experienced as we talk with community members, farm workers, and low-wage Latinx families, is the fact that this is a newer phenomenon. The research and data is still not as clear, and we have some insights as to like some of these symptoms and effects that wildfire smoke has on people's health and well-being. But we don't know what that long-term impact is precisely because that research is being conducted now, given the wildfire events we faced over the last few years. And, with communicating and working with farm workers who are constantly outside during harvest season, when wildfire season is starting, and when harvest season is ending, there is a lot of uncertainty and concern around what this means for their long-term impacts, in addition to other exposures that they have, like pesticides, that also plays a role in their health and well-being. And so there's a lot of, different factors and variables that are affecting farm workers' health and well-being. And wildfire smoke is just another thing to add to their list of concerns where we need to address and making sure that they and their families are being adequately taken care of, and have the resources that they need to take care of themselves and their families. And so that was really interesting to me to see the newer research and newer studies that are being done in order to address it. But we're also facing the impacts now in real time, and we'll continue to do so for the years to come as research continues to be developed and learned. So it's very interesting, and we are eager to learn what are those long-term impacts so we can continue informing our communities and making sure that they can take care of themselves and their families as wildfire events become worse and worse in the time to come.
Something that I think Ira reminded me of from part one that I think is really important is that when we're talking about other pollutants like traffic-related pollution or urban pollution, those are all regulated. And the Clean Air Act has done a fantastic job of really cleaning up our air. And so that air quality has improved progressively over the years since Clean Air Act in 1970, I think. And wildfire smoke is an exception to that rule because we can't regulate it, right? It is a phenomenon that comes in and we can't say, oh, we just want less of this, or there's some policy that can give us less of this. And this really impacts outdoor workers. And there are policies that I'm sure we'll talk a little bit more about later that try to protect outdoor workers, and others that have to spend more time outside. But those themselves are really new and they're not incredibly effective at this point. And so I think that is a really interesting point that was brought out in part one, is that you can regulate other pollutants and you can't regulate wildfire smoke. So how do we what are the things we can do to go around that is something we're working on.
As we also heard in part one, although wildfire smoke is impacting just about everyone, we know that some communities are at higher risk. And so I know many of you, if not all of you, have experience working with vulnerable communities. And I'd just like to ask if you have any examples or personal experiences of how your work has supported community resilience and what more you hope to accomplish in either your work or your organization as this issue probably gets worse. So how about we start with Ira, just since you do represent a very specific community, and I know you've had some success in passing a really monumental rule that protects farm workers during fire season. So maybe you could share a little bit about that with us?
Yeah, I just want to acknowledge how the um, power of storytelling and being able to share experiences that our communities face when navigating through wildfire and unhealthy air quality really led to having very protective rules um, when there is wildfire presence in the workplace. And just to share some insights into some of the things that we heard from farm workers over the last couple of years, that this is a newer phenomenon and it's very unclear what folks are breathing in, but the things that are clear is the symptoms that they're facing. So we've heard many folks who had headaches, folks who felt dizzy, people who ended up even throwing up because of how sick they felt from their exposure to wildfire smoke. And fortunately, there were some workers whose employers ended the workday early or sent them home so that they don't have to be exposed to the wildfire smoke. And then on the flip side, there are other workers who continue to harvest because of the 2020's Labor Day fires was happening at the end of harvest season. There was a lot of time sensitivity when it came to doing the work, especially in agriculture. So many farm workers were continuing to harvest using bandanas instead of having the N95 respirator, or sometimes not even have any protection from getting exposure to wildfire smoke. And given the red and orange skies and darkness that we faced during that wildfire event, many of them had to use headlamps to actually see the crops and do the work, which is a very dystopian image that you see a red, orange sky, darkness, smoke, and then farm workers continue to harvest during these moments. And these are things that we want to avoid and not have happen in the future, because we don't want workers to have their health and well-being impacted, negatively impacted by the wildfire smoke. And it's very sad to hear some of these stories because these are, people who have families and have concerns about their well-being, and at the same time, the other things that comes into question, and why people continue to work in wildfire events is because of the lack of access to income. And so, if folks don't have stable income or don't have other resources to support financially, they have no other choice but to go out into those fields and be exposed to the wildfire smoke. So there are many realities that farm workers and other outdoor workers face when wildfire events happen and there's unhealthy air quality. And we did pass some rules that are protective, and I think there's still more to do to complement what we've achieved here in Oregon so far.
Those farm workers, when they go home, sometimes particularly they're going, well, no matter where they're going home, whether that's employer provided housing or their own homes, they don't have protections there either. So it's not just out in the workday, it's once they get home. And so there's another effort now through rules, through our occupational safety and health, to focus on ag labor housing, and making sure that that's improved.
Yeah, one thing that I'd like to toss in there, and I'm really excited to see some rules being put in place in like Oregon, Washington, and California, but it's not it's not equally distributed across the countries, because these are all being put forward by states on the state level. So you have other states that also see a lot of wildfire smoke, like Idaho and Montana, where we don't have those worker protections at all. This is a complete lack of oversight on the federal level to look and acknowledge wildfire smoke as a worker safety issue. I really hope that we see that needle move in the future and have some sort of requirements that all workers be protected from ambient air pollution, and that it be acknowledged that this is a health hazard. We have a lot of documented health impacts. We know that the wildfire smoke is very bad for folks, but currently unless you're in one of those coastal states, there are not worker protections out there for you from wildfire smoke. So you're just at the whim of your employer on if they're taking it seriously or not. And that is not really a great position to put a lot of people in, especially folks who have no choice but to go to work and be in that environment. So I really believe that policy needs to be an important part of any discussion when we're talking about wildfire smoke and protecting the public. But it can't be just by jurisdiction, because you do not have equal protection for the people in this country who are exposed to smoke. And everybody should have clean air. That's why we have a federal Clean Air Act, is because we should have clean air everywhere. But as we said, we can't regulate wildfire smoke, but we can at least start trying to control how we respond to it and how we protect people from that smoke, and how seriously we take it. And that's going to take policy, it's going to take money, it's going to take all those things. But I do hope that we get there. And then also I hope that for the states that do have these rules in place, that we see enforcement of those rules and we see employers abiding by them.
I think that's a huge thing, at least in Washington. Oregon and California have permanent rules now, which is awesome. And Washington had an emergency rule over this past summer for sending workers home or providing masks when air quality got to a certain level. But the enforcement is really not there right now. Washington Labor and Industries doesn't have the staff to be sending people out to every farm and making sure that farm owners are actually taking this seriously. And so in my work talking to farm workers, we pretty overwhelmingly heard that they're not taking it seriously. That during smoky days, no one in a group of, we talked to 150 farm workers, and no one had been sent home due to smoke. Stopped work because of heat or because of cold, but smoke was not something that came up as far as stopping work or even providing masks. And so I think Sarah makes an excellent point that we are way far behind in other states that have agricultural populations, have other outdoor workers, and experience just as much smoke as the coastal states. We have to it's got to be all of those steps, right? Like we need the rule to be permanent. We need enforcement of that rule. So it's got to kind of go all the way. And hopefully we'll get there.
Yeah, and I just want to echo what both Savannah and Sarah said. Each state is taking their own measures to adopt rules and policies to protect workers when exposed to wildfire smoke. But there's also what we've heard from farm workers and our members is there's some people who are traveling from state to state, and whether they have a rule, don't have a rule, they have to learn different sets of rules or non-existing rules depending on where they're working at a given time. And for that reason, we should be advocating for a national standard so that it's applied across the country, regardless of which state that you're in. And I think that can also help with the question of enforcement of how we can make sure the employers are in compliance when it comes to having unhealthy air quality in the workplace. So just really want to echo what both Savannah and Sarah said, to really pushing for a national standard and protect workers who are exposed to wildfire smoke.
That reminds me, I was just on OHA, Oregon Health Authority's website yesterday, and for the first time noticed how many different languages materials were offered in. And Susan, I think you've done a lot of work in and learned a lot from COVID and how important it is that different states, cities, counties, and federal agencies have websites that communicate the same information. Could either of you speak to that?
Yeah, it's very important for agencies to say the same things. At the federal level, EPA works with CDC and the Forest Service with respect to smoke to say the same things about the health effects, say the same things about the ways to reduce exposure. And as I'm listening to Ira, Savannah, and Sarah speak, I think it's pretty clear that different parts of the country have different awareness of the level of the problem. And so while the awareness is probably very high in the Northwest, the Pacific Northwest, it's not as high in the eastern part of the country. And one thing that I took away from the first discussion is that we all need to be prepared. Whether we're on the West Coast or the East Coast, smoke is going to travel. And it's a little bit harder to get people concerned about it when there's not a fire nearby. And so I think making sure that communication is integrated, that people are saying the same thing, and the public is aware of the magnitude of the problem, even if there's not a fire nearby, is going to be critically important.
I think it's interesting, though, Susan, on that point, the 2021 fire season in Oregon was relatively mild compared to what we experienced in 2020. But our bootleg fire sent smoke all the way to the East Coast, gave red skies across the country and air quality impacts. So it's not top of mind the way it is for us on the West Coast or in the West, but it's unfortunately it's going to happen more and more.
We had peak sunsets in North Carolina, but I think most people weren't aware of what was actually causing that.
I can second that, Susan. I flew into Chicago and there was a red sun in the sky, and I think it was 2021, and went to visit my family in Michigan. And I kept looking at the app that we'll talk about in a little bit, and it showed that the air quality in my small hometown surrounded by cornfields in Michigan was far worse than the air quality in Portland. And my family had no idea that was happening, or they even needed to be concerned about it. So I think so many of you are often on news programs and other outlets to get the news out, but I don't feel like that's happening in some parts of the country. So I know we could talk about this for a long time, but I think we should move on, and I'm sure we'll touch on it. But my next question is, and this is a good segue. Many of you provide information and tools to evaluate, to have the public evaluate and manage their own individual risk to wildfire smoke. And on part one, we just acknowledge that there's so many variables out there for people to make their own decisions, which is what we were just talking about. And so, Susan, I thought I would hand it over to you, and maybe you could give us a little context for the viewers of like, what do we mean by trade-offs and making informed and healthy choices, and what tools do you find are the most impactful for empowering people to make their own choices?
Sure, we make trade-offs every day. And when for example, going to exercise, we know that exercise is good for you. And so we make time for that. But when there's smoke in the air, is exercise good for you? That's a trickier question. Smoke in the air makes decisions about these trade-offs harder to make. Do I go exercise when it's smoky? Do I walk the dog? EPA has air quality and health information to help make these decisions. One thing you want to do, obviously, when you're in a smoky situation is reduce your exposure. So you need to know there are 3 factors that affect your inhaled dose or exposure to PM 2.5, which is the principal pollutant of concern in smoke. These are the concentration of smoke in the air, your activity levels. If you're at a higher activity level, you're going to take in more smoke, and the duration of time that you're active outdoors. Luckily, these are easy to adjust. You can reduce the concentration you're exposed to by going outdoors when air quality is better, or by wearing a properly fitting N95 respirator. A respirator with an exhalation valve can make breathing easier if you're going to exercise. You can reduce the intensity of your activity. If you go for a walk instead of a run, you'll take in less smoke. And also you can reduce the duration of the exposure. If you cut the time in half, you'll cut the amount of particles that you inhale in half. But the other part of that is needing to know when you need to take these exposure reduction measures. And that's where the Air Quality Index comes in. The Air Quality Index is EPA's color-coded tool for communicating about air quality. It's based on the agency's extensive review and health and exposure research. There are 6 color-coded categories that range from good to hazardous. These are very important to pay attention to. Good and moderate are green and yellow. These mean that our air quality is acceptable. At orange, this indicates unhealthy for sensitive groups. And the groups that are sensitive to air pollution are people with heart and lung disease, older adults, children, pregnant people, minority populations, and people who are more likely to be exposed, like outdoor workers. When air quality is in the unhealthy range, that's red, there are potentially health risks for everyone. And when air quality is in the very unhealthy and hazardous range, purple and maroon, these warn of increased risk of widespread health effects. So the air quality index is based on population-based studies, so it really can't tell any individual how they may be affected. So what people need to do is check the air quality index regularly, see where they fall on the scale, and pay attention to symptoms. A symptom is an indication that you need to reduce your exposure.
Yeah, no, I just wanted to give a kind of a practical example of how we in the state build on that, and to the earlier point about being consistent, being on the same page. We got a lot of questions from school districts and athletic organizations when we had very late wildfire season this year in October, with fires in Washington State in particular impacting our largest population center in the Portland metro area. And so we have a guidance that we had already developed for athletic organizations, sports leagues, things like that. But we got questions about recess, right? So what do you do? And so families and school administrators came down on different things. We are trying to strike a balance. We heard on the first panel this concern that the benefits of exercise get canceled out by the effects of smoke. That might be from a medical point of view, but from a behavioral, psychological point of view, those kiddos need to move their bodies, in the course of a day. Today, they need to move their bodies. So, we have a chart that said, first of all, and I think, Susan, you said this, it depends on the individual's health status. So there are, kids with asthma or other conditions that make them more susceptible. And there's always the notation for those kids, it's ratcheting it down. But keying off that EPA, green, yellow, orange, red, at this level, air quality, AQI, you can go out for 15 minutes and reduce the intensity of the exercise, and then it kind of goes from there. So that's a practical way that we can help make people decide about those choices and make the trade-offs.
Yeah, not only kiddos need exercise, but adults need exercise too. One thing we're learning more about are the mental health effects of smoke and being indoors all the time. So exercise is good not only for your physical body, but for your mental well-being.
Sarah, I know Gabriella just shared some of the resources that are made available by Oregon and the kind of the behavior change that we have to take in schools. Does some of that also happening in Montana, or things look a little different there?
Well, I think one thing I wanted to point out that I think is really useful for people when they're trying to make decisions about their day is localized smoke forecasts. So people actually can have an idea of, is it going to get better? Is it going to get worse? So they can plan their activities throughout the day. And that is something that we provide in Missoula. For Missoula County, I put out smoke forecasts at least once a day during fire season, sometimes twice a day if it's getting really changing. And we push those out through the local media. We push it out to the schools. We push it out to really anybody who's said that they're interested in knowing, so that people have the ability to have some agency for their day. I can't make smoke go away. I can't make it go away, but I can at least give people enough information to use to make some decisions about when is a good time to go running, and what do I need to go and get my air cleaner and turn it on, and help people make those choices. Now we do have a very similar to Oregon wildfire smoke activity guide, both for children and for the general public. That's put out by the state of Montana. And that has very similar, it's like based on the AQI and the person's age and underlying health conditions, how much you need to ratchet down your activity levels. One thing that I liked to point out to people, that I learned this from Susan, because Susan is a great resource for anybody who's interested in interpreting the AQI and understanding it, that AQI advice, it's really based around like 1 day of exposure. And as we have these prolonged smoke events, where you fall on that chart is who you are as a person might change. And so you need to really pay attention to how your body is feeling, how you're experiencing the smoke, and what might be okay for you when it's in the orange might not be okay for you in the orange anymore, and you need to only do that activity in the yellow or the green. Or there's some people like diehards, they go out running, it's in the red. Or I've seen people play football in the dark purple, and I don't know why they do that, but they do. And, you need to start making those decisions of, okay, that might not be a great idea. The smoke's been here for a long time, and the longer you're in smoke, the worse you feel because your body has been fighting it that entire time, and you aren't getting a lot of relief unless you have a really good access to clean indoor air. And so as you have these long smoke events go on, you start to have that heaviness in your chest and more headaches, and your stomach starts to feel upset, and your entire body is just kind of starting to react to it. And your own tolerance is going to go down. We've also seen, just anecdotally, tolerance from fire season to fire season starts to go down because if you're exposed to smoke year after year after year, just anecdotally, where you fall on that category, how you look at the color of the AQI and what decisions you make is going to change. So you might not be able to be as active and feel good as you did a couple of years ago with that level of smoke. So you need to be paying really close attention to how your body feels and not just go like, oh, I am a 35-year-old person with no underlying health conditions. I can go and do whatever. No, pay attention to how you're feeling and ratchet back as necessary. And also, do not shame people into exercising with you. Like, respect how people feel. I know you want a friend with you on that run, but if your friend says, no, I don't feel very good, don't make them go. So anyway, these are things that we tell people. And it's important that folks understand, like, you need to really make those good decisions. Also, though, for children, they are at the whims of the adults a lot of the time. So adults have an extra layer of responsibility for how we go through and look at their exposure, and when we need to ratchet back on their exposure, and think about things like soccer practice and football games and these really strenuous things, that there's a lot of things that drive them to go forward, and how we want to look at that and interpret it in the basis of what we know are the health implications of smoke exposure. So I can obviously talk about this for a very long time, but I think that we need to keep learning more. We need to keep understanding what these longer smoke events mean for people at all ages and all health categories, and try to make really good choices as best we can.
Yeah, and Sarah, I think you're right. The special emphasis needs to be placed on schools because children spend so much of their time in schools. So as far as planning goes for more and bigger smoke events in the future, looking at how schools can protect children is of critical importance.
Yeah, absolutely. And, right now, there's no requirement that schools do that. And that's something that we have seen even locally, where you have some schools that respond to smoke and they're like, oh my gosh, putting in really, really good filters. We're going to put air cleaners in every classroom. We're going to ratchet back on how strenuous our physical activity levels are and really try to take advantage of any good clean air we have. We're going to move our games to a town of cleaner air. And then you have schools that just either don't have access or knowledge to create those safer spaces. There's no requirement that they do so, and they have a lot of other priorities because schools are stressed out. Like, schools have a lot going on right now. And so they don't have the resources necessarily. They don't have the mandate to do anything more. And they have a lot of pressures to just kind of do what they can. And so we have this, even in the school environment, unequal access to cleaner air for those students. So in the absence of any requirements that schools provide those cleaner indoor air spaces, we aren't seeing that. In Montana, we had a push. We tried in 2018 to get some rules on the books for the schools to provide better filtration and cleaner indoor air during wildfire smoke. And that, unfortunately, didn't go through. We did at least get some language in there that schools need to limit smoke intrusion, but enforcement, how do you even do that? So yes, I would want schools to be the safest place for kids to be. If we have schools have clean indoor air, and if we have schools have even like gyms with really clean air that kids can be like really rambunctious in, which clean big spaces can be hard to make because there's a lot of smoke that comes inside. If we can get there, and schools can be the safest place they can be, then parents can go to work and they don't have to be stressed out about their kid being home, because sometimes schools close because of smoke. I'd rather have those schools be open and have clean indoor air. If those kids are in their classrooms, in a safe space, have clean air, the parents can go to work. There's no worry about childcare. So that's something that where we need to get as a society of are we going to treat this as an opportunity to really invest in our kids and their health and their safety, and also, as we learned from the first part, in their ability to take tests as well.
I want to just flag something in that context, that we saw the Inflation Reduction Act that Congress passed recently, and over the next 5 to 10 years, we're going to see billions of dollars invested in energy efficiency, electrification, weatherization, other measures to reduce greenhouse gas emissions. But we really need to have health at the table to maximize the health and equity co-benefits that are possible if those resources are invested in ways that prioritize resilience to smoke and other climate impacts and the people most at risk. So it's an opportunity for schools. It's an opportunity for all the vulnerable populations that we've been talking about, marginalized communities, low income, rural. There's really an opportunity here, but we need intentionality and we need help at the table to point to where who is most at risk and where those investments need to happen.
And I think a big thing, and both Sarah and Gabrielle kind of mentioned this, is that we need access in these schools to information about air quality. We talked a little bit about indoor air monitors, and they talked about it in the first program as well, but schools are not going to necessarily know what their indoor air is like if there's not access to information. And there's several really great community-based programs that are looking into and have started integrating air quality monitoring programs in schools. There's a Love My Air Denver program in Colorado that's doing a fantastic job in elementary schools. But I'm trying to do a similar thing in Washington. But there's also a lot of hesitancy, I will say. Schools want their air to be really clean. They want places to be safe for their kids. But you put in an air quality monitor and it shows that their school is not safe, they're going to have a lot of problems with parents and others. And so getting through, that's an additional barrier that we don't usually think about, is that almost like a backlash from learning what the indoor air quality actually is. And so how can we overcome that as well, where giving them the knowledge, but then also giving them the resources, schools I'm talking about, the resources and tools to improve air quality. And I think the Inflation Reduction Act, bringing in money that way. There's also a lot of money that came in with COVID. Honestly, a lot of schools got money to improve their indoor air quality. And so how can we use that to benefit the smoke infiltration as well? It's a huge opportunity. And I think it's exciting that we're all kind of thinking about it and talking about it. And so the more we've been talking about clean air centers or clean air spaces, access to clean air. If we can make schools that in a community, that can be helpful not only to kids, but for the community more broadly.
Yeah, and one thing that's really exciting in Montana is a new program they just launched. They're taking $10 million of leftover COVID money to provide as many air cleaners as any school in the state asks for their spaces. So I'm really excited for that. So then we just need to get those schools to actually take advantage of it. Because as much as I am a fan of trying to use policy to try to move that needle, unless you also have the resources for people to respond to that policy and do anything with it, it's kind of meaningless policy. So we don't have a policy requiring cleaner indoor air in schools, but we are actually going to have this opportunity to help schools get there, which is really exciting. So definitely those large, big chunks of federal money is an opportunity.
Thanks. And before I move on to the next question, I just want to acknowledge that the first time I got to connect with Susan, we spent the first 10 minutes debating if I should have ridden my bike to work that day or not. And it was really helpful. So I one of my favorite parts about this job that I'm in is my ability to learn about changing my own behavior. And I have learned a lot. And now I'm running that air filter in my house every day instead of just during fire season. So Gabriella, did you have one more thing to say before we move on?
Well, I totally support such a big focus on the populations that we've talked about um, seasonal migrant farm workers, about school populations, but there's a lot more vulnerable people, and I think we are seeing, certainly in the West, in Oregon, our recent climate disasters spurred our legislature in 2021 and 2022 to invest in programs to build resilience, with a priority on communities with low income and with environmental justice factors. And that included immediate short-term fixes, like providing smoke filtration devices to Medicaid eligible people with medical vulnerabilities who live in wildfire-prone areas of the state, as well as longer-term efforts. We're standing up in my program, a Healthy Homes Grant Program, and that will finance comprehensive improvements to residences that target climate resilience, for residences and for multifamily housing, and those will protect indoor air quality. And we're hoping the federal funding I mentioned will also be a big expansion of this infrastructure that we're building to help build climate and smoke resilience.
The most supported science tells us that this issue is going to continue and potentially even get even worse, right? And so we've already talked about so many different opportunities that we can improve community resilience to wildfire smoke specifically. But what would each of you like to see as like a next step in the work that you're doing to build more resiliency on this issue?
As we see these resources that our state legislatures are dedicating, that the federal government is bringing to the table, we're suddenly in the kind of welcome situation of maybe having resources available, which typically we have not. But how do we get it to that last mile, to the people who most need it? And for the person who, you know, either through language or education or other reasons, has higher barriers than others. How do you navigate all these different pots of money in different siloed organizations with different program requirements? So the thing, actually, just before this conversation, I was on a call with an array of state agencies and legislators who are thinking about how to develop kind of navigation systems. How do we make it easy for the person who needs these interventions to get them? How can we collaborate, across government and different levels of government and nonprofit organizations, community-based organizations, philanthropy, to figure out where the gaps are? How do we make it seamless for the person, at the receiving end, to get what they need to live, safe and healthy lives and get protected from smoke and other climate impacts? So that infrastructure is a really high priority now.
Well, I agree with you completely. And I think one gap is that we need to educate health professionals. These are doctors, nurses, and health educators. We tell people, you need a plan. Go see your doctor. Go see whoever takes care of your health. They go to their health professional, and the health professional doesn't have this in their wheel kit. So we need to educate health professionals. We at EPA have developed a course, Wildfire Smoke in Your Patient's Health. We're trying to promote that. We stand ready to help medical and nursing schools develop their own curriculum. But when people get that information from their own health provider, they really pay attention, and studies show they're much more likely to take action. So I think that's one gap, along with all those others that you mentioned, that could really be helpful.
Yeah, and that's a good point. The gaps, like you all represent, to me, a really broad sector of people working on this issue. So there's city, state, and federal agency staff. Ira, you're representing a community-based organization, and Savannah, the research happening at all these universities. So I think it's really interesting to hear where those gaps are and how we can fulfill those across the country. And Sarah, I know you started off the conversation with talking about how Montana doesn't necessarily have some of the same rules and regulations that the rest of the state. But what I'll hand it over to you. What would you like to see as the next step?
Well, one thing I want to also kind of highlight is not every community has someone who has the time and energy and the knowledge to pursue resilience and pursue interventions and find ways to protect the communities. I do want to put a plug in, though, for any stressed out, under-resourced public health people out there. The EPA has their great wildfire smoke guide for public health officials. It's pretty dang comprehensive and has really handy one-pagers and information sheets that you can use to get into your community to give them some advice. But I really think that one of the really big gaps we have right now is capacity and having people on the ground in communities across these wildfire smoke affected areas. The state of Montana, Missoula has a wildfire smoke ready week. We have a coalition of nonprofits and partners at the local government level and university, and we all work together to really push resiliency into our community. We only have one other county in the entire state that has started taking these steps. So we don't really have the capacity at the local level across these regions. So how do we build that? How do we create that kind of boots on the ground thing? Because as some research that Savannah worked on kind of Washington really shows, you need to have someone local driving these efforts. And we don't have someone local in every community.
Savannah, that's a good transition to your work. I know you focus on the biosocial research, which I find fascinating. And could you share a little bit about the next steps you're taking and what you're prioritizing in your research?
Yeah, I mean, I think a huge thing, and I think it's so awesome that World Forestry Center did this first program from researchers and now is talking with kind of the on-the-ground people. You all are the on-the-ground people, Ira, Gabriella, Sarah. And I think a big gap that I have seen from my perspective and what I'm trying to do with my research is take all of that wonderful evidence-based scientific knowledge that we know and was talked about in the first session and translate it into communities. So how do we actually take that research and make sure that we're creating interventions that are actually helpful or implementing interventions that are based on this research? And so that's, the research that Sarah just referred to. I did a risk communication project up in North Central Washington, trying to understand what messages are actually helpful and who needs to be sharing these messages. And it's local trusted sources. So people like Sarah, people like Ira, people like Gabriella that are living in the community, that are talking to people about smoke exposure. But as Sarah mentioned, I think this is incredibly important. Not every community has a Sarah. The majority of communities that are impacted by smoke exposure don't have a smoke readiness champion. And so I think I would love to create more of those. How do we make it so that there's more and more people that are aware of this work and willing to be that person that is looking for resources and pulling in the tools that are needed to really help the communities that are severely impacted but are not aware of it. And Susan and Tim, you both talked about this. It's moving across the country as well. We're seeing smoke exposure in North Carolina and Michigan, where communities maybe are not getting quite as prolonged exposure, but it's happening and they're really not aware of what the health impacts might be. And so I think just really upping our communication and education around what health effects are and steps that we know work that we can take is what I'm working on and hoping to get more people to work on too.
Great, thank you. Ira, I want to hand it to you next just because you are, again, representing a really specific community. What are next steps that PACUN are wanting to take around protecting the farm worker community during wildfire smoke?
Yeah, so things that PACUN has been working on and will continue to work on over the last year. One of the first things that we launched earlier this year was creating a wildfire preparedness and rapid response program for community members who are being impacted by wildfire smoke, both an education component and also practical readiness component that folks can have their evacuation bags and like all the information that they need to ensure that they know what to do, what evacuation level 1, 2 through 3 means. There's a lot of confusion. There's a lot of uncertainty. I think the resources are available and in languages that our community speak. And in my case, a lot of folks speak Spanish. but it's making sure that they have access to those resources, they know where to find them, they're receiving the communication from our county officials and all the things that we know exist. Making sure it's all ready and available for our communities is something that we are continually working on. I know things that we've discussed and are open and interested in is, as Gabriela mentioned as well, as having climate resilience hubs, because we know that this is going to be an ongoing issue. And there, not all the homes, not all the apartments, all the living spaces are adequately prepared and weatherized to combat wildfire smoke or other extreme weather conditions. And so being able to develop those in very well-known, trusted locations and places, whether it be churches, nonprofits, organizations, community centers, the place that our community knows and have trust in, really making sure that they are prepared and equipped to be a hub for those people who have nowhere else to go. So that's what I will share with everyone today. We'll continue working on this issue across a variety of people and populations, and making sure that we are protected as much as we can be when it comes to facing wildfires and wildfire smoke.
Great, thanks, Ira. And I think that is, I'm glad that you just went last, because I feel like it's a really good example of a group of folks that are taking action on the ground and supporting specific communities. So I just want to thank all of you for everything you're doing on this issue and for being here today. I know you're all very busy, and we appreciate you just taking the time and sharing your expertise with our viewers. We certainly look forward to having more discussions. And I think it's so important to go back to just what I said in the beginning of identifying the impacts and then the actions that we can take to better support community health. So thanks again for your time. And for all of our viewers, we're going to try to post some links on worldforestrycenter.org that takes you to various websites and resources that these folks have worked on that can be used in your communities. So thanks again, and we'll see you soon.